Hi, everyone. This is Sean with the MassSupport Network here with your COVID-19 update for October 20th, 2020, Tuesday. So looking at the cases and deaths worldwide, since we took last week off from a Tuesday update due to the holiday, we're going to be looking at an average of the last 2 weeks, but mind that as things are trending upwards, last week was probably higher than the week before it. But worldwide, we have crossed 40 million cases, an average of 2.4 million new cases each week in the last 2 weeks, which is 250,000 more than it was the week before that. In the US, the increase was 380,000 new cases, which is about 70,000. And here in Massachusetts, we're about 4,500 new cases per week. In terms of deaths, things are holding steady or dropping off for the most part. We saw about 37,000 new deaths per week in the last 2 weeks worldwide, which is a little bit trending down. Here in the US, about 5,000 as things are also trending down and holding steady. And here in Massachusetts, about 111 per week there. So looking at the country's trends graphically, here's COVID Tracking Project's latest graphic update. So we've got the good news on the outside of the graph there, as deaths are plateaued and tests are increasingly going up, but cases and hospitalizations are also on the rise. Now, the real thing to look at there is the hospitalizations. I mean, our testing is at unprecedented levels right now, so some of that is going to make the cases a little bit higher as we, especially many places which, like colleges and such, which are testing asymptomatic people for screening testing, because we'll test cases that we never would have noticed otherwise, and that is good. But when we look at the hospitalizations, we see that that is really on the rise there as well. And we were in a trailing downwards in death, and that is more even and has been for a little while now. That may mean that we are about to start trending up again. So looking at where this is happening across the country, we have, this is just the new cases per state. This is just looking at yesterday, so this is not indicative of trends, but just a one-day snapshot here, and you can see that the Midwest continues to be the current epicenter right now, but we are starting to see more places in the rest of the country as well. So Wisconsin continues to be the hardest hit there, and this is just total new cases. This is not adjusted for population. So Wisconsin is had more new cases yesterday than even California, Texas, Florida, possibly even combined. Just eyeballing that, I think that's about the same there. So that Midwest area is really bearing the brunt of things right now. And looking at more in depth, when you do adjust for population, this is the number of cases per million people by the various regions. First of all, you can see each region is trending upwards, some more sharply than others. But the Midwest is really bearing the brunt of that, followed by the West. But we are seeing a pretty steep uptick here in the Northeast. So we do need to start perhaps being a little bit more cautious about how we face the pandemic. We can't just be saying, well, we dealt with it, it's over. We need to be prepared that we are going into a new wave. Speaking of which, we have been talking about the concept of a second wave since before we even started having a first one, basically, because we've been taking cues from the 1918 flu pandemic. So just for a point of comparison, I wanted to throw out a graph from 1918 of the, this is a graph of the deaths during that pandemic over time. So let's take a look at that here. So they initially saw a spike in the midsummer that died down and then reached its highest peak in the autumn, right around the time that we're in right now, which eventually trailed off in the late winter and then had one last spike again in early spring. So a lot of times we have been drawing cues from this or making predictions based on this for our own pandemic. Obviously, COVID transmits a lot differently than the flu, as we're learning, but this is just kind of what we've always been afraid of, is that anything we've seen in the summer is going to be nothing compared to where we are in the fall. Now, of course, now this is just looking at deaths, not cases, not hospitalizations. We don't have good numbers on those from 1919, obviously, but this is just a possible projection of how things could go. But at the same time, things are obviously much different than they were a century ago, both in terms of our technology and our society. So we can't hold too fast to this. But this is just kind of anyone who's thinking about a second wave, this is what's always coming up there. All right, so let's move on to some developments here. Just a couple of quick ones here. First up, there has been an increase in using rapid tests. There's shown some effectiveness in San Francisco. They've been studying them as it's there for screening testing. Also, Heathrow Airport is starting to offer them as a paid service for travelers who need to get tests for the country they're going to. Rapid tests are an interesting possible tool for dealing with COVID. However, it's very important that they are used correctly because they are not like PCR tests. So these are much more likely to get a false negative, but in the case of a rapid test, that's usually okay if you're using it correctly, because you understand this is supposed to be used for short-term predictions and not to be a clearance that you're in perfect health. But the important thing with rapid testing is just understanding that we need to have the infrastructure around them, the understanding of how the testing works there. But we are seeing some promising results, especially from San Francisco, about the potential for use as a screening tool. Also, COVID has reached the Vatican. The Pope appears to have not been exposed at the moment, but people in his household have, and many members of the Swiss Guard. That's another area to watch for there. And finally, New York City schools are showing some very promising results from their experiment reopening. There have not been any major outbreaks. They're conducting a lot of surveillance testing for in-person schooling, and have had very few cases come back positive. So it's potentially true that this is a model that schools can use to reopen and for in-person teaching, which would be great. We all know how much better that would be for students. But this is still very early results, so we don't want to get ahead of ourselves on that. And hopefully in a little while, we will have better information on if things are working out that way. And let's just check in quickly with how we are on vaccines. Now, even though we have a number of front runners in phase 3 trials, there are still new projects coming on all the time. There's a new one in phase 2 trials and 4 more in phase 1 trials. So there are still plenty of other contenders coming along. Even if these first couple ones don't end up working out or not being as effective, we still have plenty more projects in the pipeline. Also, Russia put a second vaccine into early use. Again, those vaccines for earlier limited use are often skipping phase 3 trials, or basically using early approval as a phase 3 trial, or doing them at the same time, which of course has the risk there may be some unexpected side effects, or might not be as effective, which is why we run these trials and don't just approve them right away. Okay, you can find stats and trends at the usual places. And for more from the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.